What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy. I hope you had a great weekend. And of course, if you had to take a test for any of the viruses, I really hope you have tested negative. It is time now for the Monday edition of the Virus Update for Monday, August 18th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Give me 15 minutes of your time today, and I will inform you of the current state of COVID and maybe some other viruses here in the United States. If you're new to my channel, subscribe down below. Give this video a thumbs up if you like today's video. Hit that notification bell. Share this video with anyone you know. And if you want to support my work here on the channel, there are ways to do that, such as Patreon or becoming a member of the channel. Alrighty, we do have a few news stories today. Of course, the weekly B&O update. We do have some other stuff to look at. Some weekly data, including Walgreens. And we do actually have some news about Wastewater scan. I don't know if it's news, but it's something that you're going to have to pay attention to, and there may be an update on it the next day. Yeah, normally I would show wastewater scan data. We're not doing that today. I'll explain at the end of the video. Starting off with BNO News in the weekly update. COVID cases are approaching 100,000 in the United States. In fact, they're probably over it. They're estimating that there's 98,600, but, you know, with at-home testing, people not testing, we're missing a large number of cases here in the United States. Hospital admissions, 6,902. That's actually up by 15%. In the hospital, 4,800. That's up by 11%. In the ICU, 581. That's up by 10%. New deaths, 227. The average is 206. That's actually up by 3%. So we are very much so in a COVID summer surge right now. Cases and hospitalizations are continuing to rise across the U.S., now at the highest level since early April. All right, here's some real proof. For all those people saying, oh, COVID's over, why don't they talk about it in the news? You don't hear anything about it. Here's some real facts about this year in the United States. So far this year, more than 3.6 million COVID cases have been reported in the U.S. That doesn't sound like COVID's over, causing 252,952 hospitalizations and 17,039 deaths. That also does not sound like COVID's over. And for those who are about to comment, well, we had more flu deaths than that. It's only August. The number of COVID deaths is going to continue to go up. The number of deaths from this current wave, that will start going up even more, probably as the southern states more than anywhere else, since they've been getting hit so hard. All right, it's the back-to-school season. Yeah, we're coming to that portion of the summer COVID surge. You know, little Tommy or whoever, you know, is going back to school, and, well, maybe their pal, Philip, or whoever else comes to school sick because their parents decided to send them to school that way. And then little Tommy gets infected, and say the grandmother lives with him. Yeah, and he goes back home and takes what's home and gives it to grandma. And then grandma gets sick. Well, there's so many people that say, oh, we're not going to take precautions to save grandma. Well, you know what? That's selfish. We should be taking precautions to help protect grandma or whoever else. The high-risk category, whoever it may be. And, yeah, the back-to-school portion of the surge is always so risky because your child can go to school, he can get infected, and then you can bring COVID home. And guess what? You lose time at work because you're sick. You risk getting long COVID. There's so many things that can go wrong at this time of year. I really don't like the back-to-school portion of the summer surge. And then, of course, pretty soon, just a few months away, we'll get the winter portion, which, yeah, the winter surge is ridiculous because we'll combine all the viruses together. But, yeah, COVID rates are rising highest in the southwestern United States now, at least according to this report from Medical Express, which they do use data from the CDC. Yeah, things just continue to go upward here in the United States. Some states are showing some signs of some peaking. Florida was one of them. We'll have to see if that remains the case this week. Hard to say if it will. New Zealand, COVID weekly update, August 11th through the 17th. New cases in New Zealand, 583. That's actually down by 5.3%. Reinfections, 377. That's 64.6% of the cases. Deaths, up by 75%. 7 deaths. Total deaths, 4,760, up by 7. In the hospital, 58. That's down by 3.3%. 64.6% were reinfections. Sadly, They say, or Dennis says, this is Dennis, the COVID info guy we're sharing this from, 25 deaths reported today. COVID attributed deaths 7, not COVID 1, and then just status not available 19. One was less than 10 years old. That's something we have not seen in a while. One in their 40s, one in their 50s, 7 in their 70s, 10 in their 80s, 5 were in their 90s, and were aged over 90. And 8 were women, 17 were men. So unfortunately, 25, that's a high number for New Zealand. That is not something New Zealand should be proud of whatsoever. Texas, get this. They're declaring the measles outbreak over. I was wondering when they were going to do this. They haven't reported a new case in a while. The Texas measles outbreak that sickened 762 people since late January is over, state health officials said Monday. That's some good news, and as you know, many people thought this would go on well into next year. Well, it hasn't. Could they still report more measles cases? Sure, they could. All right, state officials warn of an uptick in whooping cough cases. And I believe we're talking about Hawaii here because it says Hawaii Public Radio. I had to refresh myself with this. I queued this story up early this morning. Yeah, Hawaii state officials report an uptick in whooping cough cases, the highest in a decade. As of July 31st, just over 200 cases have been confirmed in Hawaii. So, yeah, that's not good whatsoever. Moving on now to this. In case you're new here, here's my website, datareport.info. It is loaded with info. You can find studies. You can find all kinds of information over on my website, which is what I call the internet encyclopedia of these viruses. It really is. It's just an archive. That was my main goal when I started this site, was to make it just an archive of information. People who tested positive for COVID, sports-related illnesses, all kinds of different stuff. All right, moving on now. Here's a tab we probably won't be using anymore. This is the Texas measles tab. Hopefully we will not have to go back to using that. I will probably even remove it. Canada, viral activity levels. COVID-19 is moderate. Flu A is low. Flu B is low. And RSV is also listed at low at this time. Already, we got an update to the heat-related illness map. We're still seeing some coloring in the northeast states, though I must say today is a little bit cooler. Last week was not. It was really hot here, at least portions of the northeast. I know northern New England, it started to cool off a little bit over the weekend, but from Pennsylvania on southward, it was really humid and hot this past weekend. Not as bad in the southeast, though. Florida, yet again, you're bad. That's to be expected in the summertime. Taking a look at the West Coast for heat-related illness emergency EMS calls, and we can see here, yeah, there's definitely some calls there. Still some calls in the Great Lakes and Midwest, though portions of the Midwest, you can see it's starting to trend downward a little bit. Same with the Northern Plains. Still some counties listed. Texas is not doing so great. Arkansas is not doing great either. Also, in the Great Lakes, Michigan. Yeah, there's a lot. Look at that. Much higher than average is showing up in some places. Same can be said in Arizona, in the Southwest, and maybe portions of New Mexico as well, even Oregon. Alrighty, moving on. Taking a look, let's see what's going on with the air qualities today. I'm going to refresh this. Let's see what we see. This is the first time I looked at this today. I'm going to be flat out honest with you. Hey, now we're still seeing some yellow in the southeast. Okay, but look at the northeast. Much better. Look at the west coast. A bit better. Yeah, this is a fairly good day. This is the best this map has looked in a long time. Despite whatever colors you see on here. Yeah, I get it. There's some problems in portions of Nevada. Just a couple, and Los Angeles. But we're not seeing widespread reds and oranges and purples. We're not seeing it like we were. We will take this. Taking a look at what's going on in Pinellas County, Florida. Yes, there are some EMS calls right now. Look at that. Electrocution is showing. Hey, yikes, that's not good. Something gone wrong there. Taking a look at what is going on in Philadelphia over the weekend. Sunday, they had 748 EMS incidents. Saturday, which was a very hot day, Philadelphia reported 832 EMS incidents. A quick note about all this EMS stuff. I think I'm going to stop showing this on the Sunday portion of the videos. I said, we're making changes for the Sunday videos. It's going to be like a vlog. It's going to be called, have a cup of coffee with me and let's look over some of the virus data. and maybe a little recap of the week, and then, of course, a lot of wastewater. That's the changes that I'm slowly working on for something. Yesterday was the first time I called it something different. We'll see. It'll be changes going on. The algorithm needs to adapt to it. It didn't like it for some reason yesterday. I don't know. Maybe you all were busy yesterday and didn't get to see my video. Take a look at this. Chester County, Pennsylvania. Yeah, look at this. There's a lot of calls going on there right now. Sick person. Respiratory difficulty showing up several times. Sick person again. What? Yeah. I don't like when I see respiratory difficulty show up so many times when air quality is not that bad. Especially in the middle of a COVID surge. Montgomery County. Yeah, respiratory emergency showing up there. How about Bucks County? Let's see what's going on there. I need to refresh this. Yeah, I got a feeling the COVID surge is getting worse in southeast Pennsylvania. Of course, we're in a data blackout. Pennsylvania did not update last week. Will Pennsylvania update this week? I honestly do not know. And take a look at this. One of the busiest Mondays we've seen in a while when it comes to hospitals in eastern Pennsylvania. We're seeing problems in the Poconos, the Lehigh Valley, which means Allentown, Bethlehem, Easton, northwest of there is doing bad. Southeast Pennsylvania has a few hospitals doing bad. That's not something I like to see whatsoever. New Jersey, I need to refresh this. New Jersey has several hospitals with problems. Central State Medical Center, patient volume. Looks like a divert. Cooper University Hospital, full and total, patient volume. Inspira Medical Center, patient volume. Inspira Woodbury, SED, psychiatric issue, and that's it. I thought there was another one. But again, that is 4 hospitals in New Jersey dealing with issues today. Good to not see Penn Princeton Medical Center having any issues. New York State reports 424 new cases. Again, they have gone a little bit lower. We'll see if it goes back up when schools go back. And taking a look at the hospitalizations, they have also gone a little bit lower. 324 people hospitalized, 30 in the ICU. Alrighty, time now for that weekly Walgreens update. And full disclosure here, there's a lot of states, you can see, all these white states, that did not update. So this is limited data, but despite that, testing interest has gone up once again. 3,597 testing being reported versus 3,149. So imagine if all these states had tests reported. Hey, we would have even higher testing. The national positivity rate for COVID is 32.8%. That did go down ever so slightly. New York State, though, when it comes to your COVID positivity rate, did go up ever so slightly. 34.8%. That's actually more than slightly. 7.4% increase. 92 tests versus 73. Yet we see something different on their dashboard. I'm convinced there's something wrong with their data. Florida, 37.4%. Remember, you had dropped, and now you're going back up again. And the number of tests went up. That's a 3.1% increase for your testing. Michigan, 30.8% positivity rate. That's up by 1.8%. 39 tests versus 38. That's 1.8% for your testing positivity rate. Hang on, wait a second. Wisconsin, we almost jumped ahead of ourselves. Wisconsin, 36.6%. That's up by 12.3% with higher testing. Iowa, 42.9%. Only 7 tests, but that's a big jump from the previous week. Missouri, 35.2%. That's up. Wow. Up by 25.8%, 54 tests versus 32. Louisiana, you actually improved. It's about time you did. 23.2%. Washington came in at 36.1%. That's down by 10.9%. Arizona, 26%. That's down by 15.8%. Texas, 37.9%. Higher testing, 949 versus 782. That is up by 2.1%. New Jersey, what's going on there? 32.2%. That's actually up by 9.9%. Your testing dropped from 103 to 87. That's a slight drop for testing. But again, I think it's a combination. We have been seeing New Jersey going higher. And New Jersey themselves said they're seeing a slight increase in emergency department visits and hospitalizations. Pennsylvania, 30.8%. That's down by 13%. And Mississippi, 13.9% positivity rate. All right, here's that wastewater scan news. Yeah, take a look at this. We're essentially seeing nothing for a wastewater scan. Yep. And if I go over to, let's just go over to X real quickly. I did actually make a post here. And maybe someone actually chimed in. No one chimed in. But, yeah, when you go to just their regular website, wastewaterscan.org, you get this. I hope that does not mean it's the end of Wastewater Scan. Let's go over to their page. Do they know about the fact that they're down? No, they're posting something from the Washington Post. So, unfortunately, right now Wastewater Scan is down. I hope that's not the end of Wastewater Scan. If we lose Wastewater Scan, that would be a huge, huge setback. Not only for me in these videos, for everyone, for those who do the COVID modeling. So, yes, let's hope we get that back. Alrighty, guys, that does it for the Monday edition of the Virus Update. If you enjoy today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday afternoon. Thanks for watching.